So thank you for joining our third webinar in our virtual education series for patients and caregivers. The webinar today will be recorded for those who are unable to attend and will be available through our website for later viewing. Following the presentation, we will have a question and answer session. Please use the raise your hand feature to be unmuted so that you can ask your question verbally, or alternatively, you can type your question in the chat box. We're very excited today to have with us two speakers to discuss collaborating with your clinic to improve your health care. Our first speaker is Kathy Sabadosa. Kathy is a Senior Research Associate at the Dartmouth Institute for Health Policy and Clinical Practice in New Hampshire, and she manages the National Quality Improvement Program for the U.S. CF Foundation. Since 2003, she has published quality improvement resources, led benchmarking efforts to explore best practices, implemented a national survey to capture the patient and family experience of care, and co-authored clinical care practice guidelines and related manuscripts. She's currently an operational lead in both the CF Care Model Design Project and the Robert Wood Johnson Foundation Co-Production of Care Pilot Project. In addition to her professional expertise in CF care and quality improvement, Kathy also brings another perspective, as she is also the parent of an adolescent with CF. Our second speaker today is Lila Khan-Cruikshank. Lila was first introduced to cystic fibrosis in 1991 when she met Dean, who she would later marry in 1998. In 1996, she started volunteering with the Ottawa CF chapter and later served as president of the Stratford and District chapter, which is now known as the Hope chapter, from 1998 to 2003. She and Dean then embarked on a cross-Canada cycling journey called Second Win, Cycling for Cystic Fibrosis, to celebrate Dean's 40th birthday and to raise awareness and funds for CF research. Since returning from Second Win, Lila and Dean have been involved in various promotion and education activities through the CF clinic at St. Michael's Hospital. In 2008, they were recruited to be among the founding members of the St. Michael's Hospital Patient Family Advisory Board, the first PFAB in Canada, and they continue to be active members of this group. So I'll now pass the presentation over to Kathy to start us off.
Hi, good afternoon, everyone. First of all, I'd like to thank CF Canada for inviting me to join this series, and I'm just so appreciative to share our work in the United States with all of you and my colleagues from Canada, and also the people and families living with cystic fibrosis. So thank you very much for this opportunity. Next slide, please. I just wanted to set the stage for our time together this afternoon to talk a little bit about the context in which we in the U.S. have been putting into place to engage patients and families. So I thought I'd start by sharing a little bit about the work of the Cystic Fibrosis Foundation in the U.S. to help set the stage for the engagement. As you all know, the CF Foundation has been very active in basic research, drug discovery, drug development, clinical care, and then getting all of that to people with CF. If you want to advance the slide again. We in the U.S. have if you keep going, there's some animation. Yeah, we in the U.S. have a care center network of 119 CF care centers. There are 107 adult programs and 51 adult programs. If you can continue to advance the slide, you'll see that we have also a patient registry, similar to what you have in Canada. And each one of the centers report in data to that registry, and it's all reported out annually and shared widely with providers and people with CF. We also have a peer accreditation process in the U.S. Physician teams go out and visit our centers every 3 years and report back the quality and delivery of care at those centers. If you want to continue. We also have put into place some clinical practice guidelines to bring evidence to the treatments that are delivered to people with CF and their families. And we've been very active in this arena for several years. You probably are all aware of the most recent work that we've done in infection prevention and control. We are about to release some guidelines in mental health screening for anxiety and depression, and also NTM. So we've been quite active in this area as well, so that we make sure that care decisions are based on good evidence. Next slide, please. One of the most of the work that I've been involved with the CF Foundation has been in the quality improvement arena. In 2014, we did a supplement to sort of capture all of the quality improvement work that we were doing nationally. And this work is very close to my heart because for me, this is where all of the basic science, drug discovery, and drug development meets the patients and families. It's where the providers and the patients and families meet. So getting that right and really improving that experience and that care delivery is so important for all people with CF, both for the providers and bringing joy to their work and for people with CF and their families to get the care that they need when they need it. So it's been a real privilege for me to work so intensely in this effort on behalf of the CF Foundation. Next slide, please. So all that said, I joined the foundation, as you probably heard, in 2003. And we were just getting started here with a vision for improving care for people with CF. And some analyses were done of the registry that showed our higher performing centers were getting better results and longer life expectancy for their patients and families than other centers. So the foundation set into motion a vision that we could make that type of care happen across all of the care centers in the United States, and that we were really committed to adding additional years of life by improving the practice, by practicing CF care centers and with quality improvement. Next slide, please. This initiative took on many, many activities, and you can see some of them are listed here. We have a web-based patient registry that the foundation has been supporting and keeps, ever growing and active in the care centers. We launched a learning and leadership collaborative series, and that again was to bring quality improvement training and principles right to the care centers and to people with CF. Canada followed suit and also now has their own learning and leadership collaborative series. We did some benchmarking work, as you heard earlier. Those high-performing centers, we went out and visited each one of them to try to capture what we didn't see in the registry data to bring back to others and to spread across our network so that people could learn about what we call the secret sauce of delivering care. We have a discipline-specific mentoring program in place. Dietitians, social workers, respiratory therapists who are new to CF care have a chance to follow and shadow people who are more experienced in their discipline and to gain that experience and bring it back to their center. The patient and family engagement and partnership, that's what this webinar is about, so I'm going to take a deeper dive into that. Transparency of center-specific outcomes. We in the U.S. have made the decision to share all of the outcomes data publicly with patients and families. And then, as I shared before, the clinical practice guidelines, so that those were evidence-based and accessible to the care teams and people with CF. Next slide. Again, I'm going to focus today, really take a deeper dive into our experience in engaging people with CF and their families. The next slide. This is a slide of the Cincinnati Children's Medical Center. This was one of the first centers in the U.S. to really take hold of engaging patients and families. In 2002, the team at Cincinnati Children's Medical Center actually contacted the CF Foundation and asked three really important questions. They wanted their center-specific data. They wanted to know how they were doing as a care center compared to other centers. They asked for where high-performing centers were because they wanted to go out and visit those care centers. And they also asked their patients and families to join them. Once they received their center data, they shared it with their patients and families, and they asked their patients and families to help them improve the care delivery at their center. So at the time, in 2002 and 2003, this was really innovative and groundbreaking work. If you go to the next slide. Well, this led to this ask on behalf of Cincinnati Children. It's really led to some strategic thinking on the part of the CF Foundation. I mean, they were looking at the time of the variation across the centers. They were thinking about, they saw that longer life expectancy. So we put together a plan in 2003 to enact this. And we set some 7 worthy goals for ourselves in and around that vision and plan. And you can see right at the top, because of the work of Cincinnati, making people with CF and their families full members of the care team was first and foremost among our worthy goals. We also saw that people could achieve normal growth and nutrition. People would be diagnosed early and get the right treatment for respiratory infections, decreasing the spread of germs between people with CF, preventing complications or diagnosing them early on CFRD, and now we're taking that forward in mental health because, as you may all know, mental health can impact adherence. Providing care regardless of race, age, and insurance. We're working really hard here in the U.S. to explore new value models and thinking about how people access their care, and then supporting all through transplantation and end-of-life care decisions. So, again, patients and families are at the heart of everything that we do, and we kept them first at the top of the list. Next slide, please. We wanted to, after setting into motion this strategic plan and these national goals, get the word out amongst the people in the CF community. So one of the first things that we did in 2004 is we invited the Cincinnati team, who had been working together for about 4 or 5 years, to share their story at the North American CF Conference. We invited Jim Acton, who was the physician lead on the project, Paul Batalden, he's here at Dartmouth, and Honor Page and her then young daughter Annie in 2004. Annie is now 21, to speak at our North American conference and to share what it was like from each side or each perspective, a care team opening up with their results and patients and families learning that the care they may not be getting was as good as it could be and how could they help. So this was a really powerful way to sort of show our community that it was okay to share data and to ask for help from amongst the patients and families that they care for. Next slide, please. By December of 2004, we really got a push at the national level at the CF Foundation. Atul Gawande published an article in the New Yorker about what happened in Cincinnati and what it was like from both sides to see their data and to know that they could ask for this type of help for improving care. And he also calls for the foundation to become transparent for everybody. Everybody should have the same opportunity that the patients and families in Cincinnati Children's did. So this was a real push for us, if you go to the next slide, to take a hard look at the data and to really think about how we could start to address finding those best practices and spreading it back. So we started by encouraging our care centers to take these graphs that were coming out of the patient registry and share them openly in conversation with their patients and families, doing something similar to what Cincinnati Children's had done. So we did this for a couple of years between 2004-05. If you go to the next slide, by the end of 2005, the foundation had come to realize that we really need to share this information freely so that if you keep going with the animation, that we could all level the playing field. So we formed a committee. You can keep going. Next slide. We formed a committee to actually create the public reports that are now available on the CF Foundation's website. It took us about 1.5 years to go through the data and look at how to adjust it and how to display it. And now you can go on and log on and look at any care center's data anytime. You can see adult and pediatric lung function. You can see adult and pediatric nutrition, as well as some of the screening metrics are available as well for each care center. This year, the foundation made publicly available what we had termed the Center Director Report, and that has about all 200 measures that get reported across the registry, and so now that's available to everyone to see. So we've freely shared all of our data at this point. If you go to the next slide. When we did this, we thought it was important to give or to make available for patients and families and for care teams a framework of how to work together, how to engage in care delivery and improving care at a CF center. So we adapted material from the Institute for Patient and Family-Centered Care, and we created sort of a matrix, if you will, for centers to use and for people with CF to use to work together. So centers and people with CF had the option of doing everything from surveys to focus groups to perhaps creating advisory boards having occasional reviewers and consultants, having people with CF and families come in and review processes of care, or perhaps consult on a particular project. The matrix also included advisors or consultants for a lead team. If a center had a lead quality improvement team, they could be members of that team. And then also some centers went as far as having a healthcare professional and a parent or patient-led improvement team. So they were co-leaders sharing the work of improvement together. Next slide. In all of our quality improvement work we were doing, we have an action guide that outlines both the quality improvement process, but we also included a component on how to engage patients and families and some of the activities that patients and families could do or partake in to help with the improvement process. If you go to the next slide, this just demonstrates one of the tools that's within that action guide. It's a shadowing tool whereby people walk through or take it through the eyes of a patient, a journey, and they shadow and observe through their clinical experience what they're experiencing, how much time it might be taking, and who's doing what. And this is really, the patients and families have a very unique perspective on receiving care at care centers, so we thought creating some tools and some mechanisms to help bring that voice into the improvement process is really important. If you go to the next slide, as the QI work rolled out over the years, we started to collect what we called smart change ideas. So rather than reinvent the wheel at every center, we started to collect and collapse some of the ideas and then share those freely across the network. And these are just a sample of some of the ideas that came across. Establish a list of specialists with knowledge about CF, standardized processes for home IV and therapies, and feeding tube placement. Some of the big items that patients and families really felt was important and to make the care experience better. If you go to the next slide. We also, at the national level, started hosting a series of webinars and webcasts. Just, it's, again, another channel of communicating how to partner with your team and how to get involved. And all of this material, we had a toolkit that was developed and put up onto the CF Foundation website. It was made available to both care teams and people with CF to start to learn how to work together. If you go to the next slide. These are some of the accomplishments from that time of working together. As you can see, patients and families have been involved in any number of activities at all different levels, national levels, local levels, et cetera. And some of the things that have happened is newborn screening. From the time that we started engaging patients and families to now, all 50 states in the United States have newborn screening programs. State programs are patients and families have been very active in getting programs for kids with special needs up and running in particular states. Improving care delivery, you can see some of the tools that were created. An adult group out in California created a patient and family wallet-sized medication card that they can carry. So whenever they're having to go into the ER or other settings, they have that list of medications. Care plans for clinics. People with CF and families and care providers were really active in creating streamlined care plans that are easy to use, easy to follow, take home. Inpatient brochures, another enormous activity. What do you bring to the hospital? What's that first admission like? Daily goal sheets for inpatient stays, exercise, school schedules, things that you might need while you're in an inpatient setting. And then attending retreats, summer retreats, and feedback, et cetera. More and more centers started to actively invite people with CF and families into their care conversation. Next slide. Another set of activities is education materials. People with CF and their families have been very, very active in helping centers with websites, newsletters, Facebook pages, developing annual family advisory education settings, creating patient and family presence at the North American meeting. People with CF and families have started to attend the North American CF Conference, and this is just a photo of a recipe book that was created by the Atlanta Family Advisory Board. Other sites have parent-to-parent mentoring programs, and some have started neighborhood gatherings for people who just need support and need to hear from one another. So those are some of the accomplishments the advisory board has made. Next slide. As you can see, we tracked all of this work and all of our progress over time. We're happy to report that it's very few centers at this point that don't have some type of involvement from that matrix I presented earlier, people with CF and families being involved in their activities. Next slide. If there are any of folks interested in the North American Conference, between 2010 and 2014, it used to be a one-day track where people with CF and their families were invited to come on Saturday. We started to open that up a little bit more by offering some online streaming as well. Well, I'm happy to share that in 2015, CF advisors are now invited to attend as full partners with the healthcare professionals. There's no more designated track. Everybody is coming, so it's an all-share, all-learn environment. And so to me, that's a really great milestone that we're just now truly immersing the entire community together to talk about CF care and its delivery and its proven activities. So if you're interested in going to the North American Conference, I highly, highly recommend it and attend the whole thing. Next slide. I wanted to go through some of our most recent activities on a national level to see what we're up to. In 2011, Bob Bell called Dartmouth and said, you know, the UK is doing a patient experience of care survey, and I'd like to do one here if that's possible. So some colleagues and I here set out to create a national survey, to go to the next slide, that we've launched in the U.S. The survey, again, it's at every care center at this point, has 7 domains, and it's 55 questions, with 5 of them being open-ended. So people with CF and their families can give us verbatim answers to about their experience of care. We ask questions about the timeliness of care, the professional team, ability to self-manage, infection prevention and control, patient-reported outcomes, and hospital care. We have 2 versions. There is a version that adults fill out, and there's a version that caregivers of children with CF fill out. And the time frame for this survey is we ask you questions over the last 12 months, your experience of the last 12 months receiving care. If you go to the next slide, this will show you the rollout of the survey. I'm sorry for that animation. We started in 2011, and it was only part of the accreditation site visit process at that time. We did a pilot, and then, as you can see, 2012 and 2013 was part of the site visit process. And then 2014. In this year, we're now rolling it out to all of the CF centers across the United States. And currently, we have about 107 programs that are participating, 40% of the 270 that are eligible. So we're getting some nice uptake, and we hope to have more to report out as that goes forward. If you go to the next slide, you can see this gives you a snapshot of what the care centers and programs receive for a report. So they get some scales, they get comparison to how they compare to other centers that have completed the survey, and they also get the verbatim questions back. And I have to say, the centers that are receiving these reports find the verbatim questions most interesting to read in terms of understanding the experience of care from the patient and family's point of view. So if you go to the next slide, this will show you the national deployment. Again, we're going from all centers to a continuous process. As I shared, all centers will be rolling this out, and patients will be asked to complete this every 6 months from their visit. We're hoping that this will both help improve the return rate, but also really begin to feed back some data in some real time so that care centers and patients and families can respond to it and promote some QI and activities at their center. If you go to the next slide, I wanted to turn real quickly to some new work that we're doing to really up the engagement or accelerate the engagement of people with CF and families into improvement. We're currently working on a new or a CF care model design project, designing a care model of the future, co-production work, patient engagement initiative, and the foundation has recently launched a national adult advisory board that is looking into one of its first activities would be launching an adult peer-to-peer mentoring program. So if you go to the next slide, the care model design project is really for the first time sort of taking a national look at including parents, people with CF, healthcare providers, CF center leaders. This is an all hands-on deck activity, and it's been really fun. We're using some platforms for communication. We're sharing openly and dialoguing. There's a lot of discussion that goes on, and it's just been a really great process to be a part of. And what we're creating is a learning health system. If you go to the next slide, this shows you some of the work groups that have been set up to follow this idealized design process that we're using. And again, the folks on this slide are a mix of providers, people with CF, and parents who are all working within these groups and across groups to get this process up and running. The next slide shows you where we are. We've had some conversations and design meetings. We've generated a lot of ideas about what we thought the care model future might look like. We did some environmental scanning, talking to groups like Amazon, like Google, going outside of healthcare and looking for new and innovative ideas to bring into the care model. We then met in May, and we've now sort of launched some design concepts. If you go to the next slide, we've reorganized ourselves into what are the most important topics that we think we're going to be influential in the new care model. And as you can see here, automated pre-visit planning, dashboards for home tracking, bundled payment reform that's important in the U.S., transitions, a QI network, an enhanced registry, some shared decision-making, all of the people that you saw on the earlier slide in the work groups, and then some new folks that we picked up along the way are now working on these design concepts. And the idea is that we would take some of them into the field and pilot them with some CF care centers. So that leads me to my next piece of work, which is the co-production pilot that's being sponsored by the Robert Wood Johnson Foundation. This work will particularly take a deeper dive into the dashboard development, such that there's a dashboard for patients and families to use at home for home tracking, a physician module that will help the care teams track CF center data as well as individual data, and then we're hoping to link this, we're working on linking this to electronic health records and the CF patient registry, so that patient-reported outcomes would now become part of the CF Foundation registry. If you go to the next slide, this will give you some details about the health information technology solutions we're looking at and what would be the underlying components of the patient and family module, the clinician module, and that enhanced registry. As you can see, it's things like viewing your health status over time, perhaps setting reminders to administer your care, or to keep track of insurance issues. On the clinic side, you'll see things like facilitate care decision, manage patient populations, benchmark against best practice, and at the bottom is the registry and bringing those patient-reported outcomes into a dashboard setting and ultimately into the registry for clinicians and for researchers as well. This isn't a dream. Some of this work is actually taking place. There are two demonstrations that we've been looking at quite closely. One is Orchestra. It's a platform that does some of that self-tracking at home and feeds into the electronic medical record. This is being piloted at Cincinnati Children's Medical Center. And Genia is a similar platform that was built in Sweden and is being tested and piloted in the Swedish CF Care Center. I included some links you can watch. We had some videos or brown bag sessions on each one of these tools and what they're capable of doing. So I included those links so you can go ahead and take a look at those and see what's happening in that arena. Next slide. The patient and family engagement or patient engagement initiative is really around adherence. As we all know, there's lots of things given out in clinic, but what actually gets done at home can sometimes vary. And so we're really taking a deeper dive into, from the foundation perspective, how to enhance that relationship between care teams, physicians, and families so that people can optimize their health. The patient engagement initiative there are 5 pillars to this work. There's a stakeholder advisory group made up of parents and people with CF again that meet quarterly. There's a communication or promoting dialogue campaign, as they're calling it, to really learn how the conversations happen and transpire in a clinical setting and also outside of a clinical setting. There's objectives and measures that they need to establish to understand whether or not these initiatives are working. There's behavior tests and interventions that are going on. There's a research consortium that's been formed around this so that we can test different interventions and then hopefully with that launch into spread through collaborative learning. And then how would this all be embedded into a CF care clinic? So those are 5 activities. Cindy George at the CF Foundation nationally is leading this effort. If you go to the next slide, this will just give you an outline of some of the priorities of that group and the work that they're doing. Again, there's a plan for implementation and multi-channel communication, communication awareness. Each one of these pillars is supported by the activities and priorities. And the last slide that I have is truly the Foundation Adult Advisory Group. This is new to the CF Foundation and just a really, really exciting group of people to have on board. I've had the privilege to work with this group to help set up their peer-to-peer mentoring program. They meet also every other month and are just very, very active at this point, really advising the foundation and really talking about what matters to adults in CF. And I think, our population in the U.S. is now 50% of our folks are over the age of 18. So this is just a really exciting, important group to call together to really think about what the future of CF care should look like. So I'm going to stop there, and thank you very much.
Okay, thank you, Kathy. I think we'll go straight into Lila's presentation now, and then we'll save the questions for the end.
It is a privilege and a pleasure to be speaking to you today on behalf of St. Michael's Hospital CF Patient Family Advisory Board. As our name suggests, we are a group of patients and family members who act as an advisory resource to the CF team at St. Michael's Hospital. We actively participate in the development of new programs, provide input to the CF team with respect to a variety of matters relating to continuous quality improvement, and we review recommendations coming from the CF team. We are also a liaison promoting strong relationships between patients and family members and the CF team. Collaborating with your clinic to improve your health care is not only the title of this webinar, but it is also what we as the Patient Family Advisory Board exist to do. The relationship between PFAB and the CF team is very much a two-way street, with each of us seeking input from the other. We are blessed to have such a dedicated group of healthcare professionals who really want to hear the patient and family perspective so they can continue to deliver top quality care. Our concerns are always taken seriously and addressed as best as possible, resulting in improved service delivery in the clinic and in the ward. Working together with the CF team, we help to ensure that the services provided by the CF team really do meet the patient's ever-evolving needs. Our Patient Family Advisory Board came to be due to the commitment of our CF team. St. Michael's Hospital's CF team has always strived to continually improve the quality of care that it delivers to its patients. Through the efforts of Dr. Tullis, the CF team was invited to be the first Canadian site to take part in the U.S. CF Foundation's Learning and Leadership Collaborative in 2008. Following the guidelines of its U.S. counterparts, St. Michael's Hospital CF Quality Improvement Team formed the Patient Family Advisory Board. Our CF team recruited members for this new board either by giving potential members a questionnaire to complete to see if they would be a good fit for a PFAB, or by specifically approaching patients and family members who had previous involvement or interest in such a role. Initially, our board consisted of 10 members, 8 patients and 2 spouses. Members were chosen to represent a range of patient and family experiences. We each committed to serve for a minimum 1-year term. Members had to be available for monthly in-person meetings in Toronto. Due to infection control protocol in effect at that time, this meant that members had to culture negative for B. cepacia complex. We also had to adhere to a 3-foot separation for patients at all times. The members that you see sitting closer than that are actually patient and spouse. Over the past 7 years, there have been some changes to our board membership and to the way in which we conduct our business. I'm now the only non-CF patient on our 7-member board. 5 of our current members are founding members, demonstrating a very strong commitment to the board and to improving CF care. Following a breach of infection control that resulted in new acquisitions of B. cepacia complex, tighter infection control policies were put in place. Consequently, we've been unable to meet face-to-face since September 2008, and we now meet monthly by teleconference. Although there are definite benefits of meeting in person, there are now no restrictions as to B. cepacia complex or any other bacterium, and members' geographic location is no longer an issue. Our current board consists of Melissa Benoit, one of our new recruits, having joined us in the fall of 2013, my husband, Dean Cruikshank, me, Erica Light, our newest recruit, having joined us last spring, Bob Mason, Roger Murray, and last but certainly not least, Shannon Price. Our members' experiences are quite varied, with health challenges running the spectrum, from fairly routine checkups to more challenging management needs. One of our members even had a double lung transplant over 20 years ago. Each member certainly brings a unique perspective to our meetings. What is our goal? Well, our goal is to help the CF team shape the clinic and the ward into a service system that is patient and family-centered, efficient, and cost-effective. And we achieve this through continuous quality improvement initiatives. Once our board was established, we immediately got to work on some fundamentals, beginning with establishing our meeting schedule, creating our terms of reference, and following the example of the QI team, assigning roles. The only formal role that continues to be assigned is that of recorder, and this role is rotated amongst our members according to our meeting schedule, which is set in the fall for the following year. In order to keep the lines of communication open, it's very important to have a liaison between PFAB and the QI team. Prior to our monthly conference call, one of our members calls into the QI team's weekly meeting to provide updates to QI and to answer any questions. On the subsequent PFAB call, this member reports back to us. This role is rotated amongst our members. Similarly, a CF team member will call into our meetings. Role assignments are included in our yearly schedule. We're very fortunate that everyone on our advisory board shares a commitment to help improve CF care at St. Michael's Hospital. We all understand that we are volunteering for the good of all of the patients at our clinic. To this end, personal gripes or disagreements about the clinic are given no time during our meetings. We don't just identify problems, but we're always looking for solutions. We respect and protect the privacy of all sensitive material and persons that arise out of our role on PFAB. And we all share a commitment to adhere to infection control protocol, whether at the hospital or elsewhere. In order to promote our PFAB to patients, we developed materials to distribute and have available in clinic and in the ward so patients can learn about us and have a way to communicate with us. A board member is assigned to monitor our email account and to forward emails to all PFAB members. An automatic response is sent to the patient informing them that their message was received and that, unless their matter is urgent, their comment or concern will be addressed at our next scheduled meeting. Every email receives a personal and timely response from PFAB. We also developed our own website, which ultimately became a section within the Toronto Adult CF Programs website. Over the years, we've used various strategies for recruiting new members. We've reached out to our fellow patients and family members using a business card that is handed to patients in clinic. And for a number of years, we designed a Christmas card insert to be included in the clinic's annual Christmas mailing. We've also reached out to CF patients through posters and flyers in clinic and through information on our webpage. CF team members continue to approach patients who they feel may be interested in joining PFAB. As a result of our CF team's commitment to continuous improvement, we've been able to provide feedback to the team on numerous QI projects involving a range of topics, including clinic wait times, nutrition, physiotherapy, mental health, drug coverage, infection control, the Toronto Adult CF website, and even a transition booklet for new patients transitioning from sick kids. While it can be difficult for a healthcare provider to understand their actions from a patient's perspective, the same applies the other way around. But we've seen some various positive changes with the input and sharing of ideas between PFAB and the CF team. In fact, at the request of the hospital management, we were able to provide input into the planning of the new patient care tower at St. Michael's. Other CF centers across Canada and the U.S. have approached us to help them start their own PFAB as well. Staff at the London Heart and Chest Institute even made a special trip to St. Michael's on their way to a conference in Vancouver just so they could meet with one of our PFAB members. We've also had the opportunity to attend 2 North American CF QI conferences along with the CF team. As you can imagine, infection control is something that we all take very seriously. To this end, we've spent a considerable amount of time and energy looking at housekeeping in the clinic and in the ward. Our in-hospital housekeeping audits look at the cleanliness of clinic and patient rooms and public spaces. Audit results have been shared with the CF team and the housekeeping manager, educating the housekeeping manager about the uniqueness of CF and the challenges of having CF patients in such close proximity to one another. As the audit program progressed, we've seen a sharp increase in the number of satisfactory scores. We've also developed a housekeeping survey available online through SurveyMonkey for inpatients to complete with respect to the condition of their room upon admission and during their stay. We all understand the need for stringent infection control protocol for the protection of all patients, but the inability to meet in person does present several challenges to our board. Despite technology permitting us to meet via teleconference, communicating by telephone or email is just not the same as meeting face-to-face. Clarification is often required, and even simple decisions can take a long time. Another area where infection control protocol presents us with a significant challenge is recruiting. Since patients are unable to interact in clinic, or elsewhere for that matter, we're unable to get to know our fellow patients. Patient privacy is a significant hurdle for PFABs. We can't get to know our fellow patients, and clinics can't disclose patient information to us. Ultimately, we rely on our CF team to speak to patients and their family members on our behalf. Other challenges that we face include the challenge of having quorum present at all meetings, particularly with a small PFAB team. Lack of quorum results in delayed decisions. Member retention can also be a challenge for a number of reasons. In addition to the daily tasks shared by the rest of the population, CF patients have the added responsibility of taking care of their health, which can be a full-time job in itself, from inhalation treatments, physiotherapy, nutrition management, and exercise regimes. Several of our members have had to step down due to poor health. Although our members have made a commitment to PFAB, we all understand that there are times when other life events will get in the way. So what's next for our PFAB? We've begun to work with the CF pharmacist and the rest of the CF team to look at drug coverage for patients. We would like to work with them to advocate the provincial government to update its long outdated list of covered drugs for CF patients. Proper nutrition is as essential as proper medication for good CF health, and unfortunately, CF patients have very high caloric requirements, and heart healthy generally doesn't equate with CF healthy. Salt and fat are actually good things in a CF diet. As we did with housekeeping, we would like to meet with the food services manager. CF patients are high maintenance, and even something as simple as an item missing from their food tray can be problematic. We will, of course, always keep up with housekeeping and infection control issues, as well as patient education through updates on the website. We will continue to be a voice for patients and their family members, and to provide that perspective to the QI team. Probably the single most important factor in having a successful PFAB is the CF team itself. Their support is crucial. We are truly blessed to be supported and encouraged by such a wonderful CF team here at St. Michael's. They are forward-thinking and genuinely committed to continuous QI. Although they are world leaders in CF care, they are humble enough to recognize that there is always room for improvement. Not only that, but they truly value patient input and seek our input on new projects, big and small. They want to hear from us. I believe that we have such great support in part because of the open communication and mutual respect that we have for each other. As members of PFAB, we take our responsibilities seriously, and we recognize the trust that the CF team has put in us. We are truly blessed not only to receive top-notch medical care from St. Michael's CF team, but also to be able to collaborate with them and join efforts to improve health care for CF patients at St. Michael's Hospital.
Okay, thank you, Lila. So now we'll open up the floor to questions. So you can either type your question in the Q&A box or use the raise your hand button, and now we'll take you off mute so that you can ask your question verbally. Okay, so I'll start with a question here. Kathy, you mentioned the adult peer mentoring program that's in place in the U.S. Can you please elaborate a bit more about how that program works?
I'm sorry, which program?
The peer mentoring, the adult.
The peer mentoring program is just getting started. We actually had our first design meeting, and what we're envisioning it would be is something similar along the lines of around, to start with, probably topics. People who are going for transplant, let's say, or getting their first job or going off to college, and trying to match people who have gone through that experience with people who are seeking that type of information. That said, that's just the beginning. We feel that's the low-hanging fruit in our community, and so the CF Foundation would set up the mechanics to make that happen, and the group felt that we would probably start with just a small number of pairs to see how those relationships got built and what each other learned, and then think about maybe rolling it out to probably pilot it in 2 or 3 centers and then roll it out on a bigger, more national scale. So, but initially we really just want to connect people who are seeking information about some of the challenges or life events that are happening to them as adults with CF.
Mm-hmm. Okay, thank you. Are there any more questions from anyone? Okay, if there are no further questions or comments, we'll close the webinar here. We'd like to send a big thank you to you all for joining, and to both Kathy and Lila for their wonderful and informative presentations on how to work with clinics to improve your health care. Thank you to you both.
Thank you. Have a nice day.
Thank you.